Okay. Hi, Mrs. Jones. My name is Garrett. I'm going to be your student nurse today, and we're just going to do a baseline assessment. And I'd answer any questions that they have, or I'd ask if it's okay if they have any questions. For hand hygiene. Get gloves. I'd assess their mood, ask them how their day's been, just if they're feeling a bit sad or anything like that, you can see if it's affecting their it's affecting their ability to perform or function normally. I would close the doors and curtains, and I would do a general survey of the area, make sure I'm not going to trip on anything, make sure everything looks safe, no cords on the bed that are going to get in the way. And then, can I get your full name and your date of birth? And then I'd verify that, and that looks good. Okay, I'm just going to take some vital signs real quick. Take vital signs, and then I'd ask, do you have any allergies? Just seasonal ones? Okay. Are you taking any medications? Okay. What's your medical history? And they'd have occasional headaches and seasonal allergies. And then, have you had any surgery recently? And they have not. And then, all right. Okay. And so, what brings you in today? You're having some abdominal pain. That's no good. What's your pain level? And their pain level is at 3. I prefer cold air, which is characteristics. So, like, if it's a dull, sharp pain, achy, onset, which would just be like, when did it start? Location, where is it at? Duration, how long does it come in and out? Does it last? And how long does it last? Exasperation, and that's just like what makes it worse. Radiation, does the pain radiate to other parts of the body? Relief, does doing anything to make it better? And associated symptoms, just is this causing any other symptoms outside of the pain? And then after that, okay, I'm just going to check your eyes real quick. And see if their pupils are round, reactive, and if they accommodate to light. And that looks good. And then I'd ask them questions like, why are you here? Do you know why you're here today? Do you know where you're at? What's the date? Do you know who the president is, to assess the level of consciousness? After that, I'd go through, I guess. I'm gonna feel around your head to see if I can feel anything. And I'd feel sinuses, feel for lymph nodes, see if that's swollen at all. Okay, can you open your mouth and say ah? And nasal. This side. All right, that looks good. Okay, then I'd go down to the chest. Are you having any chest pain? No? Okay. Okay, if I take a look at it, look at the chest, look for any swelling, any bruising, broken skin. Okay, I'm gonna go ahead and listen to your heart real quick. And listen for the aortic, the pulmonic, the Erb's point, the tricuspid, and the mitral. And I listen to the mitral valve for 1 minute. Okay, that all sounds good. And then I asked them, do you have are you having a cough, any pain with breathing? Okay, and then I've listened to lung sounds. Something right there. and listen to all 6 points on each side. Okay, that all sounds good. I'd then look for, I'd go to the back. Both sides. Should roll you over a little bit. Okay, that sounds good. Then move down to the abdominal section. And so you mentioned you're having abdominal pain. Ask how long it's been going on for. I guess I did with the Caldera stuff. Move this over a little bit. Go ahead and see it. Take a look at it. First, I'd inspect, look for any swelling, any bloating. Just take a look at it. Then I'd listen to it. I'd listen in all 4 quadrants. Okay. Okay if I lightly touch each side? All right. And I'd palpate the area, ask if that causes any pain, feel for any underlying bumps or anything like that. Then I'd move on to their skin. I'd assess the skin, look for any broken skin. That all looks good. I'd feel for edema in the extremities. Move this down. That all looks good. I check for capillary refill, and that the blood flows back within 3 seconds. I'd feel for both for all the pulses. Okay. Then I'd assess the skin for any wounds. If there were wounds, I'd look to see how many there are, what the color is, the size. I don't know if I said it. I'd assess the skin for like the turgor, integrity, all that. Then I'd have them, can you squeeze my hand? Test grip strength. Can you push down on my hands? Stop. Or can you push up? Okay, can I have you walk to that door and back? And I'm just going to assess how you walk. And I'll look for that, look for any of that. And then I'd ask about bowel habits. Are you able to go to the bathroom fine? You're having bowel movements consistently? And if I'm having abdominal pain with a risk of bowel blockage, that could probably be a problem. I'd ask about urinary habits. Are you able to urinate fine? Any pain, any difficulty, any unusual odors or color? Then I'd assess the area, or assess the patient for any tubes that they have in. They don't have a catheter in, nothing like that, no oxygen. If they did have something like that, I would check it, make sure it's functioning okay, clean it if I need to, and then I'd when I'm assessing their face, I would check for any face droop, or like slurred smile, face droop, something like that, and then I'd be done.